Hello, everyone. I want you to welcome one of my favorite people in the world, Dr. Rifkin, out from Beverly Hills. Thank you so much for joining us. How are you?
Well, I'm very well, and thank you so much for inviting me for this podcast and informative session. I hope I can contribute a lot to all your viewers. So I'm looking forward to it.
Good.
I always do. You're amazing.
Thank you. Thank you. I've had the honor of knowing Dr. Rifkin now for a few years. He's been a part of our faculty at the International Academy of Facial Aesthetics, which we love that he's a part of. And he's also a dentist. So it fits right in with this podcast because the purpose, as we know, is to inspire others that maybe are thinking about adding the beautiful aesthetic and therapeutic aspects of injectables, but also there might be some people out there that are doing it and started it, but haven't quite figured out how to get it going. And so what's wonderful is that as we know, Botox and fillers has been around for, our academy itself, which is designed for dentistry, has been around for 15 years. So this is nothing new in dentistry. However, it has come a long way, as Dr. Rifkin would
Mhm.
probably share. And his state particularly is one of the last states to be getting on board. Things are getting so much better there. Dentists do it for therapeutics, which a lot of them have an aesthetic aspect. So it's just a matter of knowing how to appropriately put it out to your patients. But the beauty is that it's only growing. It's universities are taking, we're working with universities, we're working with so many shows
Yeah.
across the nation. And so that's beautiful. So with that, I'd like to let you tell me about your journey. When did you get started and tell me what you're doing.
Well, great. I'm so glad that you asked me this question. My attraction and focus and passion as far as facial beauty encompasses more than dentistry. Ever since I've been a dentist, looking at cosmetic improvements and rejuvenation of patients' faces, obviously is the smile. But of course, as a dentist, you think we deal with quote teeth, because it says the word dent, which means teeth. But we are so involved with the smile, the function, the jaws, the skeletal system, the muscles, and it's certainly the way the teeth affect the way the skin drapes over the teeth. And that
Absolutely.
affects your smile. And there's so many aspects to it. So when I used to get out of dental school and we talked about the aesthetics of the smile, the only things that were taught was even like denture aesthetics, which is like false teeth. And that was the only training that most dentists got on where to put the teeth in the face, where the center should be. And they dealt with the face as it was, whether you had thin lips, thick lips, wrinkles, no wrinkles, you needed a facelift, a lip lift. We never even thought about that. That was cosmetic surgery. There wasn't even really cosmetic surgery. It was reconstructive surgery from patients that had maybe accidents or traumas.
Right.
And when it got to the point where plastic surgery and fillers, injectables came a long way from when I got out of dental school, I started to be attracted to all the other ancillary types of treatments that could impact my patients' smile and the beautification of their face. And how I got started on this was when I was asked to lecture in Denver to the American Academy of Cosmetic Surgery. Um, they would like me to give a lecture. And I figured, oh, great, you're going to want me to talk about veneers or teeth whitening, the typical dental topics. And they said, no, that's not really what we're interested in. And I go, well, that's kind of confusing to me. What in dentistry would you like to talk about? I said, what is,
What year was this? Give me some reference. What year was this?
oh gosh, I'm going to say
Oh,
it's
wow.
about 25 years ago. Do the
That's
math. Okay, 1990, something like
so
that.
this is
Or
before
no, it's
injectable.
even further, longer than that. My gosh, probably 1990, 1990, so it's 35 years ago. Wow, quite a long time.
Amazing. And you know what's
Yeah.
wonderful? Because injectables, the first academy, which we were part of, didn't launch until 2006. I know
Mhm.
CATS was out there in 2003, but that's about as far back as dentistry and education in injectables goes. So that's exciting to know. So
And to let you know, there wasn't even injectables then. The basically what their topic was about liposuction, which is kind of a funny
right.
part. I
So
go
it was
like,
surgical. Yeah, but it was the integration of dentistry with surgery.
no, they didn't even want that.
What?
They said because I'm a sculptor, they know that I'm an artist and all. I
Of
do
that.
sculpting. I was an art major in college. That was part of my background, sculpting, drawing. They said we wanted to get the artist perspective on the human body. including the face, but the human
Wow.
body. So, wow, that was quite a, I
That's a
said,
compliment.
first of all, when they said liposuction, I said, you must have the wrong Dr. Rifkin. I said, I'm a dentist. I don't do surgery. I don't do fat transfer or anything like that. They said they wanted my perspective, an artist's view. So when they are transferring fat, removing fat, shaping the body the way is done, all the different methodologies, they want to know where they're going. What is the direction? What's the destination? What
Right,
should the body look like? So I did a lot more research into art and beauty, what makes a form any form more beautiful. What makes a dolphin beautiful? What makes a human being beautiful? And it really comes down to smoother lines, more even, smooth contours. Without going into the detail of what my lecture was then, I started looking at art books. I started looking at surgery books, and I started to say, well, where are they removing fat? Where should fat be? It's
right,
not about removing, it's sometimes repositioning it. So
right.
I developed a nice lecture on that. So in that process of lecturing of what I knew about the human body, the form, and the smile, I was attending a lot of their presentations and lectures, and it encompassed many things in cosmetic surgery. And it was obviously mostly surgical techniques of what could be done with the face, facelifts, body contouring. And they didn't, I think the first injectables that were tried was either fat or collagen. They
Correct.
didn't have hyaluronic acid. They didn't have
We didn't have
thread.
cross-linked yet. Yeah.
They weren't even using Botox. Okay. So I was enthralled with all the different lectures because I could incorporate that into advising my patients when they come into me to have a beautiful smile and they want to look better. They think I'm a dentist, so they think they're going to pick their own dentist to do veneers or whatever. And then they're going to ask their friend who's the best surgeon for this or that. And I was starting to think about it. I said, who's the quarterback? Who's the architect? Who's designing your face? So if I was going to refer somebody that said, I'm not happy with my lips, or I don't like these wrinkles here or there, who would you send me to, doctor? So I started researching all my colleagues and what I thought were the better before and after results, and from different uh, therapists. And then I said, I've got to know more about this. So I wanted to become, quote, not a surgeon, not a nurse, not an injector at that time. And I still don't want to be a surgeon, but I need to know everything. I need to be an expert in this, in everyone's field, but not be them. I have to be an expert in what I do. And so that's what started me on this journey, I guess, 35 years ago. And
Amazing.
so then
I
I
know
started
you so
becoming,
well, and I didn't even know that far back. So I'm glad we're doing this podcast.
yeah, it's very interesting. So I became a member of the American Academy of Cosmetic Surgery. I became a member of the California Academy of Cosmetic Surgery. And then when your academy came along, I thought it was amazing because you are now seeing the benefits of working together as a team, and
Very
a
true.
team that I can't do everything. I deal, even as a dentist, I deal with orthodontics, I deal with oral surgeons, I deal with other specialists in dentistry to reconstruct the mouth. And I need to know facial aesthetics, especially when I'm not talking about body today, I guess, but the IAFA, your International Academy, is amazing because it has a really good mix of
Yeah.
surgeons and nurses and dentists. I think it's one of the few that has such a higher percentage of dentists, which I
Yeah.
really commend you on. There are other academies that I belong to that I think are great, but they maybe only have a handful of dentists in a sea of surgeons and nurses, which is great, but I want to elevate that knowledge.
Yeah, and the beauty of how that came about is, like you said, some an academy that grew out of dentistry and essentially now is multi-specialty. And what we see on the stage is a beauty of the best, from DMDs to MDs to PAs to, and from different specialties, dermatologists, plastic surgery, facial, cranial, so you have it all there, and that's what's exciting.
Yeah, it really, really is. At the upcoming presentation, I'm going to show a couple cases to show what are the possibilities and how do we navigate through meeting the patient, discussing their needs, giving them suggestions, doing an analysis. I have an algorithm for I look at facial proportions, facial aesthetics, especially around the smile area, and can make decisions on, do you need a lip lift, or do you need veneers, or do you need a combination? Do you need orthodontics? There's a lot of different options that we have. And I love the fact that in your group specifically, in the LAMCA as well, and possibly some other groups. I'm really trying to push some dentistry into other academies so that the knowledge can be spread better. But seeing how we can provide knowledge, expertise, safety, of course, and try to get other states. I'm in California, I'm in Beverly Hills here. California is very restrictive on who they let do what, injectables, Botox, fillers. They wanted to keep it to MDs or nurse practitioners or nurse PR. That dentists have a minimal role in the ability, not the talent, but the legal ability to provide these services. And that's where the med spas can become so helpful to the natural connection between cosmetic dentistry, cosmetic surgery, injectables, by creating a med spa where there's not only the legality and the support and the safety by having nurses and medical directors perform this, but doing it with the knowledge that we can do a better job for our patients by combining our expertise, right? And the patient can, I don't want to say one-stop shopping, that sounds terrible, but at least get a comprehensive view of what we can do for someone's face and their aesthetic and emotional needs. And that's where your academy is so important. And I'm glad some states are getting more and more into it.
Dental hygienists now, 5 states that allow dental hygienists to inject. So that's incredible. We are coming a long way. From one of our top instructors that's been with us since 2010 from California. He says, finally, there's been some changes in the board of California. So like as far as board members, so things are starting to get a little less rigid. But yet California, just to be clear, there's tons and tons and tons. We've been teaching California dentists for 15 years. So it's not that they can't. It's just that they can't go full throttle like some of these other states where they can just present it from an aesthetic standpoint. But you're absolutely correct when you say that if you're not looking at the structure of teeth and everything here, then you're not really doing a service, right? In the sense that most of the treatments that we're talking about are lying right here in this perioral region, right? Like if you think about everything, it's here, it's masseters, it's all around the smile, all of this. This is monkey injections that anybody can do, easy peasy. But here is where most of things lie. So if I'm getting looked at for something related, and this is incredible because there's 2 references I want to make here, which I want the audiences to know. One of them is Dr. Arnold Klein, one of the top dermatologists that ever was. I had the opportunity to get a very important quote that was featured in the first injectables book for dentists. And he is a derm, and he said, most of my, he invented a ton of techniques, the Arnold Klein, all these,
he's my neighbor. I work with him.
Yeah, but he gave us something that was very useful for me in the beginning of launching Dentaspa, because you have to remember, we're 15 years in, but there was a point where everything was like, the people attending were very like, they were movers and shakers. They were the people that were willing to step across the line because, they felt that they could. It wasn't, now we're getting the masses. But back then it was harder. So I had to open up this field, and the way, and having that quote where he said, most of my techniques were founded on dental journals. And that just, I utilized that. I mean, I went to town with that thing. That was like in every lecture that I was on. And so people like that. And then even now, like, one of our speakers, Dr. Shinobe, another top talented, more new age dermatologist that we have here. He actually was telling me, it's funny, I go to his office because I'm like, I'm going to have Shinobe, this is a year ago, see what I can get done. And he looks at me and he goes, Anna, we're not doing anything, but there is one thing that we're doing, or that you should do. And I said, what? He goes, your masseters, they're coming at me. And guess what? Those masseters, you're thinking it's just for breaking your teeth. Guess what? No, they're also depleting your bone. And then he's like, don't have what happened to me happen to you, which I lost so much bone that I couldn't replace it anymore, right? Like there was no more putting sculpture in the bone. So and he just wrote a paper on this, so he's going to be sharing some of that wealth of knowledge here at the upcoming symposium, November 8th and 9th. But it just continues from 2008, because I was working and doing dental courses for dentists before Dentaspa for 4 years. So from then, with a quote like Arnold Klein to just a year ago, Shino saying it's always been a combination, right? Like you're saying, that's how we get the best optimal results. It's all the playing, all the specialties coming together, and especially in the playing field.
Yeah, boy, you said so much. I could unpack so many things about that from Dr. Klein, looking at dental knowledge and dental research and, orthognathic surgery. Sometimes it's jaw surgeries. You have to know the bone. You have to know the muscles. You have to know the fat. You have to know the skin. You have to know the function. You have to know the race, age, gender of patients to try to balance their face, which is always a unique, beautiful composition. You're beautiful. I'm not beautiful, but if I was more beautiful, I would have a different facial composition, okay? Because you wouldn't put your lips on my face. Wait, that sounded pretty nice, actually.
Sure. I'm sure the crowd is laughing now. No, we got to give them something to
Yeah,
keep.
I gotta laugh at some of these things. But what you said, see the benefits of even Dr. Shinobe, Dr. Klein, and so many others that are willing to share and look at outside their specific focused realm of surgery or injectable. Say, look, it's not just about skin, it's not just about muscles, it's bone, skin, function. And your beautiful masseters, even though they were a bit larger, it wasn't just about the looks. It's about the
No, it was
pressure
about
and the
that.
stress on the bones. And if you remember my presentation last year, like, why do we age? What happens to us over time? You also have to think about duplication of cells, of hormonal changes in our life. I can't take somebody who is 85 and 90, even with all of us and all of our talents and all our skills and materials, make them back into somebody in their 20s and 30s. The structure changes so much over time with function, or what we call parafunction, clenching of your jaws. These muscles wear down the teeth, move the bone, reduce the zygomas. The fat changes, the collagen changes, the layers of the skin get more crepey. These are things that happen over time. And if we can slow that down, not try to treat it superficially, look at the underlying causes. I know Dr. Shinobe is looking at regenerative, and we all are looking at regenerative procedures or
Right.
preventative procedures, not just what we can do mechanically to create a better facade so that you look younger. Okay. But you want to slow down the process, right? Of aging. So the anti-aging regenerative things are also being looked at. So we need people outside of surgery and cosmetic dentistry. We need researchers in aging, anti-aging, and whether it's medications or treatments, whatever it may be, your forum is like the foundational place for all of us to get together, share this knowledge. Our patients benefit so much from us being collectively involved in the architecture and the prevention and the health and well-being of our patients.
Absolutely. Couldn't have said it better. Yeah. So one of the things that I'm excited about is the regenerative therapy workshop, which actually Dr. Shinobe is going to lead. And what's exciting is that we've always had a PRF, PRF biofiller the last couple of years or whatnot, but this time it's going to be more exciting because we're actually going to be showcasing some new technologies from Europe we're basically their first show. It's like an intradermal small needle device, micron jet. And we're excited because this device, everybody that does PRF can probably, shake their head yes, when no matter how good of an injector you are, when you try to do the PRF fillers in under the eye, you're more likely going to bruise, get swelling and all that. So this needles were developed, and that's where Dr. Shinobe loved this device, recommended it, and we are now their first show that they're going to be breaking out of.
Amazing.
And so they're also going to be at the IFA, which is exciting.
Great. That's great.
So all these exciting new innovations, that's what the IFA is all about. So we're excited that Dr. Shinobe is going to showcase that. But I want to talk about your workshop now. I am very excited because this is actually a brand new workshop. this year we decided to do a neurotoxins workshop and include both novel uses, aesthetic uses, also therapeutic uses. So the beauty is, I have one of my favorite people, Corinne Singletary from the
He's amazing.
aesthetic medical side,
Yeah.
one of our medical trainers. She's also a board member of the International Academy of Facial Aesthetics. She'll be leading the aesthetic component. She also has a great talk. And then you will be leading more of the therapeutic approach with some of the things that you do in your office. So I'm excited for that.
Well, I am too, because I love doing the workshops. It's great to give a presentation, but it's also hands-on, seeing individual models or patients. I've even been a model to what and assess what a patient might benefit from. So obviously, as a dentist, there's a scope of cosmetics and mostly more functional. TMJ or masseter muscles, temporalis muscles, gummy smiles. This is a big one. I have cases where patients have been told they need a jaw surgery, they need a forward maxillary impaction, they need osteotomies, they need full gum surgery, and just because they have a little bit of a gummy smile. This is where the neurotoxins, the Botox type Dysport, or all the other ones that are out there can benefit the smile and eliminate or reduce a gummy smile in combination with potential fillers. And of course, the cosmetic dentistry all plays a part in designing what needs to be done. What's wrong? The lips, the gum, the muscles. What can we do to benefit all of those? And of course, if there's headaches, there's frontalis, glabella, even the sides in here, all the facial, digastric, all the platysma muscles, everything that needs to be treated for
Managed.
both, yeah, managed and felt, yeah, it will be great. And of course, I'm limited in California of what I can do, the scope of zones of what I can do and why I do it. I love doing these types of cosmetic and functional neurotoxins. I love doing the design of lips to surround, be the frame of the teeth, whether it's no veneers or veneers, minor gum surgeries if they need it or benefit from that. All of that put together in a list in what I call my algorithm for a smile design. You first have to analyze what's going on, what's right or wrong. Very importantly, a lot of benefits of my patient are the photography, and the series of photos that you take will help you understand and help you communicate to the patients, what do we see here?
Right.
One of our patients that I worked on with Dr. Keon, she had a slight lip asymmetry, and it wasn't really a lip asymmetry. It was a lack of supportive teeth on one side. So the teeth were tilted in, the lip dropped down. So with correcting the teeth, the lip automatically, without fillers, were symmetrical. So you have to decide what is the problem. Okay. Is it skeletal? Is it dental? Is it gingival? Is it lips? Is it muscles? All of those things put together. It's not difficult, it's not difficult. You just have to think about it logically, decide what's wrong and what are our options for treatment.
Well, you
And
said it.
that,
Yeah, you said it perfectly with the whole, gummy smile situation. There's so many patients that hate it, but they would never get a surgery out of it. And maybe some will, but it takes seeing what it would look like to kind of get to that point and accepting a minimal, gingival display surgery. But having that as an ability to do where you're just controlling the muscle is so exciting, right? And so, in this workshop, I'm excited because we're going to kind of go through all of it, including the photographic. I know that if anybody's ever seen Dr. Rifkin's presentations in this audience here, they're phenomenal. So I don't want you to miss that, but I'm excited that you're actually going to be able to share this in a more intimate setting with the group that's decided to take this neurotoxins workshop. So I'm excited to see that.
Yeah, it's all of these workshops that you have their place. I mean, I love the cadaver dissections, okay, to really see the layered anatomy. I always talk about layered aesthetics. Even when I build a sculpture, I build the skeleton, then I put the muscles on, then I put the skin on. If anybody's maybe seen my sculptures, that's a process, a step-by-step process that I think about when I'm building structure. And the cadaver workshop, it gives you better visualization and also enhances the safety. You know,
Right.
nobody wants to do fillers around the eyes and cause anybody to be blind or the nose or anywhere like that. hugely important. Okay, do no harm, benefit the patient, be safe, and then the ability to diagnose what is the best treatment, where to go on these, whether it's a filler, whether it's sculpture, whether it's any of the types of filler materials that we have, whether it's threads. Where are we going when we're looking, on the surface, and we're kind of working, I don't want to say blind, totally blind. We're not working totally blind, but we're looking through our vision and knowledge of what the anatomy is. And
And we're actually gonna
all of
we're
these
actually gonna
workshops.
do ultrasound this year as part of the
Yes,
cadaver workshop. So it's both all in one. That's gonna be,
amazing. That's so
you know,
important. Yeah,
it's
we
gonna
have these tools. We got to use them.
absolutely, absolutely.
Yeah.
So I wanted to kind of ask you a little bit about in your office, how do you integrate? Is that part? So if somebody has mass TMD or gummy smile, is that part of what your intake? You're already kind of talking about that from the beginning. So it's part of your entire, tell me how you incorporate it. How do you do it naturally in your office?
That's a great question. So it first starts out with an interview with the patient, what their goals are, what their problems are, what their chief concerns are, what their long-term goals are. So we get a little bit of an interview, a narrative. So I get to know them as a human being. What are their goals? What do they expect to achieve if it's not just pain relief from a typical emergency situation? What do they hope to achieve by some sort of reconstruction or smile makeover? Are they going to get a job here in Hollywood? Are they going to get a great part in a movie? Are they going to get ready for their wedding? First of all, it starts with that. Then I take a very full survey of photographs, and I have a lot of my photographs up on my big monitor. So when I have my patients come in here, I don't know if I can show you this, but if you can see any of that, I have a
Yeah,
lot of
I see it.
photographs that are being taken there,
Mhm.
and a lot of measurements of their facial structure. So with properly aligned, perfect or best photography methods, you can now really be accurate or more accurate on how to design or communicate to patients what their benefits would be or what the problems may exist, asymmetries, anything that might be large masseters, and different angles will tell you, because that's, I learned this from being a sculptor. I have to look at a sculpture in every possible three-dimensional angle. I'm like a drone over a sculpture. I'm on the side of the sculpture. The same thing with faces. You have to see everything, and then you have to understand proportions, general proportions. Everybody's unique. There's not one set of linear measurements that work, but there has to be some starting point. And that's where I created this somewhat algorithm, this decision-making process. And so the photography is important. Then looking at different measurements, like I talk about, I've spoken about what is the diameter of the human iris and why is that even important to know when you're looking at the face. It's
Right.
11.5 to 12 millimeters. The upper lip, the length of a youthful upper lip from the base of the nose to the bottom of the upper lip is between 18 and 22 millimeters. So if you're going to decide to do an upper lip lift or you have a gummy smile, what is causing it? Should you have an upper lip lift or should you have veneers if your teeth don't show? So you have
Right.
to have this decision process. Also in my questionnaire, it's pretty complete. It's like, what are their basic health concerns? And if they have any aesthetic concerns. And I break it down, my aesthetic questionnaire is like, are you happy with your smile? And then comma, face, comma, lips, comma, gums.
I
And
love
they don't
it.
have to answer this question, but it's not like looking at someone
But
and
you
saying,
have the information if they do, which
yeah,
is
if
great.
they tell me it opens a door, or then I can say, well, what concerns you about your lips? Well, I don't like they're thin, or I don't like these vertical lines. It allows me to either treat them myself and talk about options or refer them to some of my colleagues that will treat it
Right.
properly, not like I might be limited in certain areas. I'm not going to do an upper lip lift, but I know kind of the answer. So I create a non-threatening or non-insulting questionnaire that they can answer and fill out. And they're very usually when they want to beautify their smile, they also want to beautify the rest of their face, right? We're
Right.
just trying to self-help, trying to make ourselves look the best we can be. If they think I'm just the dentist, which I am, but I am knowledgeable on all these other areas, I have the ability to treat or direct the patients to the better or the best person possible to treat them. So it
Absolutely.
starts with the photography, the questionnaire, and the interview. Once that's explained to them, then I can make one of these pictures much bigger and I can show them any lip asymmetry.
Yeah.
Okay. And I can tell them why. And then they get it. Then they understand. And then they're really excited and enthusiastic about making these corrections, especially if they're minimal treatment. Or it's a second or third opinion. And somebody might say, well, you need jaw surgery, you need 20 veneers. And I'm looking at it, you got beautiful teeth, you need an upper lip lift. Gravity's starting to take its toll on us, okay? And I also want patients to know when they have a long upper lip and they make longer veneers, their teeth can look horsey. Or as we get older, if they're young and they already have a long upper lip, it's going to get worse as we get older. So you have
Right.
to be careful of how much treatment and think about the long-term effect of any
Not
of the
just the
treatments,
immediate. Right. Right.
because your face is going to change. It's not the facelift today is not going to look like you're not going to look the same 20 years from now.
Right.
Even though
Even
you
when you
have the
get a
face.
facelift, you still need fillers after.
Yeah, yeah.
One of the things that that stands out to me that you said, you mentioned something that I think is what makes actually out of all the professions that we teach under the different academies that are sister companies here, Dentaspa being for dentists, the one thing that we see and that our medical faculty is always very impressed by with dentists is how incredibly, their dexterity, how they look at things in millimeters, and they're trained to do so by the nature of what they've done in their dental career.
Yeah.
When you take those skills into aesthetics, you're automatically, your competitive advantage is already there, right?
Mhm.
And that's the beauty, and that's kind of the artistic structural engineering kind of mindset that a dentist can bring from being, cosmetic
So
dentistry
important.
to
Yeah.
that. That's exciting.
Really glad that you mentioned that, because I know uh, surgeons and nurses can do very delicate work and with precision. In dentistry, we're not only working millimeters, we're actually working in microns. We want our fillings, restorations, veneers to fit with such a seamless connection
Right.
that bacteria, viruses that are 5 and 10 microns in diameter. Human hair is 100 microns in diameter. Bacteria is 1/10 of that. Okay. And accumulation of bacteria is, talk about oral and systemic health. We want to eliminate as much bacteria in our bodies as possible, and at least the bad bacteria. And so we work with precision. I work with a microscope.
Right.
Most dentists today work with loupes, which are like, 10x, 5x. I work with 20x magnification and illumination. There's benefits to that in dentistry, and my laboratory has to make things fit perfectly. The precision fit, the machining, the artistic part of it is even put that on the side. There's layers of porcelain. If you go to there's a surgeons and there's surgeons. There's surgeons that can sew up an incision with a rope, or some that can do it with, very fine ophthalmic suture that is so fine you can't even see it without a microscope. So
Right.
we use microsurgical techniques in dentistry because we're dealing with very small, tiny areas. Gum tissue
Right.
surgery, a scar on your face has to also be disappeared, right? So how you suture it together, how you treat the incisions with tension free so you don't compromise circulation, how you treat it afterwards. You have to diagnose skin type, uh, uh, doing laser afterwards. All the mindset that you just mentioned about precision, gentle, delicacy, that pervades everything that we do, in the diagnosis to the execution of your treatments. And that's a really important thing to talk about, is the mindset of precision.
That's very inspiring for our dental viewers that are out there that are trying to decide how they could position themselves in this market. But going on that, I do want to mention one thing that I think is important, and you kind of got my mind thinking about this because you mentioned something that's critical, which is knowledge is key.
Mhm.
So as a dentist, if I own my practice or if I'm at a practice, just I want to improve myself. I need to know what is out there. You don't have to become the highestly trained injector, but because this has been in dentistry for so long, it would be a disservice for you not to know about it personally, right? Like, even if you're not the one that's actually going to take the venture in doing it, is taking at least a couple courses, understanding it so that you can better direct your patient, whether outside of your practice or within.
Right.
And that's the key thing. A
Right.
lot of dentists have now, and this is beautiful, a lot of the education that we're doing at schools,
Mhm.
is where associates are now becoming they're getting their training right away. And the reason why is because they want to have a competitive advantage, because they want to go to a 10, 15, 20-year practice and they want to say, hey, Dr. XYZ, I'm trained on injectables.
Mhm.
On this I'm certified by Dentaspa. I can do the I can be your associate, but I could also dedicate to into doing the injectables in your practice. Now that dentist that maybe doesn't feel himself is the best one to offer it, or he's busy, or he's busy doing surgeries, he now
Right.
has an associate that can do that. We're seeing that all day long across the
Mhm.
board within our dental community of alumni. Another thing that we're doing, the next step, which I know is part of, I won't share too much unless you want to, part of your vision that a lot of dentists are doing, is there are creating something that is, and part of this happens because they've grown their patient base. They've now converted a lot of their dental patients to facial aesthetic patients, and it's grown too much to just have it be a part of something. They want to create an entity that's almost like an off brand from their dental brand, and they want to create like a mini med spa within the practice. I see
Right.
this in every corner in Europe. This is something that's now been happening over the last few years, more so in the United States, where dentists now own a laser, a radio frequency device, et cetera, et cetera, et cetera, because they're now bringing in, with the medical director, as we talked about, a PA, a nurse practitioner, or even that associate that wants to be a part under that, right? That they're going to be doing those treatments in 2 rooms or in an area or like the upstairs or whatever it might be. And that's where this is getting really exciting, is that it's no longer just doing some of the basics to complement dentistry. It's you can make it what you want to make it. Everybody's journey is different. I see some dentists that are just at least doing it from therapeutics and focusing on management of muscles related to dentistry. And there's those that have literally created some of the most beautiful med spas I've ever seen. So
Mhm.
anywhere in that spectrum, and whether it's self-given or directed to be given by a PA, nurse practitioner under this brand, or an associate that you bring in to grow that before you go to the med spa level. All of these things are opportunities. And I tell you, when people come to the course, it's sometimes the ones that thought they were just going to dibble and dabble into it a little bit that end up with med spas 5 years later. And
Yeah.
sometimes it's the ones that thought this was like the biggest thing since sliced bread, and that's all they want to do, and they want to do a med spa. And, they grow it to 20, 25, 30%, great, but they're not going to take it to maybe the med spa level. It is all about discovering that journey, and part of that is education. And
Right.
so, with your permission, if you want to share a little bit, you don't have to share anything you don't want, about what you're looking to do within your practice on that
Oh,
spectrum.
absolutely. Okay, so obviously I'm passionate about the comprehensive approach to treating our patients for their benefit. I'm also passionate about getting the right training for me or my staff or associates and assembling the right team to be able to provide this optimal result, okay, for my patients. I think that patients really welcome the ability to have confidence in whoever is going to assess their potential needs and has a good referral source or in-office treatment. So for me, you know me already, but your audience doesn't really. I'm very excited about setting up this dental med spa, whatever we want to call it, in my practice. As you know, we've already kind of started the process going, and I couldn't be more pleased that there is someone, and not many, or maybe only you and your team, that has the experience, that has the knowledge, that understands every aspect of setting up this. I don't want to call it just a business, but this scenario where patients can benefit, and so can the dentists, by incorporating and working with our nurse practitioner. And you have, rather than trying to reinvent the wheel myself, um, going with someone like you, collaborating and getting the expertise of you. This is more part of my journey. The business part of it, the ethical, professional part of it, is really enjoyable to me. We become comfortable in our practice. If practices is if once we're in there for 20 years, we kind of have this rhythm, we have this role, and
Right.
adding something new, more knowledge, more ability to treat our patients with greater services, is very, very exciting. So my vision is to, of course, have you and your team work with me setting up and continuing here in California with the expertise that you have, because every state might be slightly different and you know the kind of ins and outs and specifics, how to do this in a more efficient and practical and profitable, enjoyable way. And so that's my vision. So we've already kind of started on this, and I can't wait to transition because I've been practicing quite a long time. I do already have the passion and a lot of the knowledge that is foundational to understand how I can benefit my patients. And then adding this onto my uh, list of services and benefits to the patients is not only exciting for me, but
Right.
patients really appreciate it. They don't want to become the architect or general contractor of their face, as I call it. They got to find the dentist. They got to find the dermatologist. They got to find the injector. Oh, my friend's an injector, so she thought she would do it for me, whatever. That's great. But let's look at the whole face, okay? What I call, as part of my lecture coming up, is the gestalt, the contextualism, how one part relates to the other. And we don't own everything. I'm not an expert in everything, but I have to understand those basics of composition, the artistic part of it, as well
Absolutely.
as the medical, anatomical, health, and safety part of it. And
Beautiful.
that's where your academy.
Yeah, so for
I
those
want to call it part of
for
my
the
academy too, because
for
I
the
want to.
views, yeah, for the viewers out there, just so you guys understand, um, we have obviously Dentaspa. This is our Dental Injector Society, and that's our dental academy. We do monthly courses all around the nation. We all the major states, New York, Chicago, Atlanta, and that's to train you to offer and certify you to do these treatments. We have various levels from D1 all the way to D6. The IFAs are supporting academy, which Dr. Rifkin here is part of the board, alongside plastics and germs. And that's where we kind of come together once a year for innovation in the field. It's also a membership academy where you basically get portal access to so much incredible content, videos, all you name it, right? And then we have cosmetic, and cosmetic is the consulting academy, also our medical training academy. But let's talk about the consulting aspect, because for any viewers out here that maybe are doing injectables and they're like, I want to create a med spa. This is kind of what I want to kind of enlighten you on. Cosmetic has been consulting, but for many years, I focused on getting dentist teams basically showing them how to properly implement Botox and fillers. Because let's face it, a dentist can come to every Dentaspa course, but if they don't have their team on board, which is the biggest disconnect, if they don't even know the difference between Botox and fillers, if they don't know how to present it to the patient, if they don't know how to convert a dental patient to an aesthetic patient, it's not going to go anywhere, right? So you now invested all this money on CE clinical training, but your team is like, what are you doing, doc? Right? So that for many years was my role. And then I had the pleasure a couple of years ago, a great friend of mine, who Megan Smith,
Right.
she
She's
was
great.
top at Allergan. She was business development. She was just an incredible resource, even for me, because back in her earlier years, she was even a rep. So she was hands-on in there, knew the ins and outs of incorporating injectables into a practice. And so I was lucky enough to get a phone call from her one day where she said she was ready to leave the corporate world and do her own thing. So I brought her on with cosmetic, and it has just elevated what we can do for practices. For primarily, we do it now for even med spas, because she was in the medical realm. So she sort of become the medical, I'm the dental, and together we come together to really be able to, her from on ground, me from knowing the dental aspect of incorporating injectables, but her from working with teams and going in there. So the beauty is that now that dentists or anybody, med spas that want to incorporate Botox and fillers and create a med spa through other services, body and all that, can do it with our help. Because what we can do is we can do all the minutia stuff where we set the legalities. We can hire the PA or nurse practitioner. We're doing that now for several of our clients in Florida,
Yeah.
and different areas. And so we can do that and set it all up in a way where it's successful, where it works with the dental aspect, like you said, because the beauty is not, it's not to create some random entity that's sitting on its own, that's owned by a dentist, but there's a medical director involved and a PA. The beauty is coming together and saying, you know what, right across the hall, we have our med spa.
Mhm.
which, and then having a professional like you, who maybe is only like, I know you've been doing Botox and fillers for a long time, and you're doing it more so as it relates to dentistry, things that are therapeutic and aesthetic, but comprehend, to kind
Yep.
of enhance the smile and manage muscles. But now you're going to take it to the next level, because you're going to bring a top nurse injector who can do all the other stuff that your people
Right.
want, right? Like all
Yeah.
the PDO threads and cannula, all these exciting treatments and innovations, and even body, because now you have a separate entity where you can kind of host that and be able to do that in a very elevated way. So I'm very proud of you, and thank you so much for bringing Megan and I into this beautiful vision that I know you've been wanting to do for quite some time. But as we say, it's like
Yeah.
when you're ready, it's going to happen, it's going to manifest, and you're going to meet the right people. And it almost needed to happen when Megan came on board, because she's an intricate part of and such a hustler at making these things happen. And I'm
Mhm.
only one person, and I'm running Dentaspa and AFA, so I really rely on her to be able to
Yeah.
take these projects to the next level. So very excited to be in California more often through your
Well,
projects. So.
you're helping everybody, and the two of you are such a great dynamic combination of knowledge, and you take, quote, the fear out of setting up a new business model, so to speak, if we wanted to look at it that way. And the possibilities, I don't want to say are unlimited, but they're so much more expanded. My patients come to me on a regular basis, at least 2 to 4 times a year, once they're into maintenance, and they need repetitive, sometimes masseter, Botox, muscle maintenance, sometimes new fillers. So you've got somewhat of a captive clientele. I won't say captive, but they enjoy coming back in for multiple procedures. They don't have to bounce around. Okay, they can come and get their teeth cleaned. They can get them whitened. They can renew some of the injectables. They can do the fillers. They can do the Botox. And yes, as a dentist, having a nurse practitioner or a specialist in an injector can do more than we are allowed to do in specific states. And yes, we can be much more comprehensive about beautiful faces. And of course, with the knowledge that you provide with your courses and your academy, you obtain the expertise to either treat it yourself, work with your injector, or work with the cosmetic surgeons as well.
Yeah, and you know what's crazy is that there's states where everything's allowed, and even then, because they've been alumni of 10 years, they're like, Anna, I love this because my patients love me for it. Unlike the dentistry, where sometimes I'm not loved as much as I am for the aesthetics, and they can do it all, but they grow so much that they're like, I need to hand some of this off to either
Yep.
a dental associate or to a PA, nurse practitioner, where they have a medical director work under, and then they can go
Yep.
ham and do, because obviously, as if you bring in an associate dentist, he's probably just going to focus in obviously head and neck. But if you bring in a PA, nurse practitioner, under an MD that doesn't even have to be in your space as in the dental office, then you can expand that room or area or down this hallway or whatever into more of a curated med spa component that works
Mhm.
in tangent with the dental practice doing everything else. So such an exciting thing.
Very exciting.
We're gonna
Exciting for
have to
me.
do a part two once we launch and all that good stuff. So,
Sounds good. Sounds fantastic.
so to finalize this, I just want to ask you one more thing.
Sure.
What advice would you give your dentist looking to implement injectables? And in hindsight, would you have done anything differently when incorporating into your dental practice, maybe sooner? Like, is there any advice in general? Just give us words of wisdom here.
Okay, words of wisdom. Fortunately, and it took me a while to have academies develop that were comprehensive. I did take 20 years ago some courses on injectables, okay? But there was no course like or venue like you provide with your academy to gain knowledge on cosmetic surgery and cosmetic injectables, more than just dental, facial, functional types of things. So I would say just jump right in to gain the knowledge, even if you're not going to do injectables yourself. If you want to benefit your patients, be more comprehensive in understanding their needs. Patients love it when you engage with them about what you can do to either refer them to somebody that has expertise and help them in other areas. Be able to recognize problems that could be solved that you
Right.
may have not been taught in dental school, because we're talking about dentists to some degree. Also, invite your cosmetic surgeons to learn more about the dentistry part of cosmetics, the underlying dental skeletal support, musculature. Look at recessive chins, look at masseter muscles. Understand that to help the patient, if I'm a surgeon or I'm a nurse injector, yes, I can get rid of the pain, I can reduce the size, but what is the cause of this? The etiology of what the problems are should be investigated. So what would I have done differently? Probably nothing, because I really was enthusiastic about pursuing knowledge in cosmetic procedures, facial cosmetics, body cosmetics, just so I can talk the talk, and I have some knowledge and experience. Now, I don't do everything. Now, if you can take it to the next level, I would definitely say this will help your patients. This will help you as a professional, as a dentist. I think it is so much fun to be able to do these procedures for patients and have the control of all of that, the smile to some degree, um, in your own office and in your own practice. And if you want to take it and have a dentist spa or go to cosmetic, you are the resource to learn about what your options are. Okay. Get the knowledge, because it's going to go there. People are going to find med spas. They're going to find dentist spas. And don't be left behind, because number one, it's important to treat your patients comprehensively. It's important to gain the knowledge of diagnostics. It's important to understand the safety factors and understand the legalities and limitations and possibilities that you and Megan can provide with your services to help them get started. It takes the fear out of it. Take the fear out of it for me. Starting a new business is kind of scary. Like, where do I start? How do I find the nurse? How do I find a medical director? How do I know the legalities? How do I set up the business aspect of it, the
Just
fee
getting in,
structure?
in the time too, you
Yeah,
want it to be done right.
yeah.
Well, we've had countless amazing conversations over the last few years, but thank you so much for allowing this one to be aired so that you can inspire and maybe few words today help somebody make that decision to just continue working on what they're doing with injectables and or
Mhm.
book their first course and get rolling on something new and exciting. We
Yeah.
see people from, like I said, just out of dental college to your 30-40 year practice owners where they're like, I'm tired and I just want to spice things up and do something
Yep.
different that I feel appreciated for. So whatever it is that your journey, we're here to support that. And I want to thank you for being a part of this. I can't wait to see you in like 2 weeks. So
2 weeks.
excited.
Yep. Yep.
Yeah.
Yep. I really appreciate that. I will look forward to it, not only for the knowledge, but the fun and the camaraderie. I want to tell you that of all the academies I have belonged to and still belong to, and have been the president of and running programs and been program chairman, your meetings are not only insightful, enjoyable, they run smooth as silk, even though you probably freak out behind the scenes because it's a lot of responsibility. It's smooth and it's such a benefit that
Thank you.
I will never miss one of your meetings. I'll tell you. And
Well,
thank you
we're
for
never gonna
inviting me
let
to.
you. We're never gonna let you, even if I have to track
Okay.
you down
Well, I
and
hope
kind
I
of.
can keep sharing much more exciting knowledge and things that I continue to grow and learn from and learn from others. So it's
Well, it's
about
going to be an
sharing.
incredible meeting, and then we're going to
Yes.
celebrate. We have the yacht, we have amazing dinners. We're going to have a
Yep.
blast. So
Yep.
see you
So,
soon.
and sign up
And
for the workshops, because I've done a few workshops already in this academy. Other academies will be fun to do the first one. The response that people have after they go to the workshop, to being able to see it, ask the questions that you can't always ask the speaker, the
yeah,
hundreds
with
of questions.
180 people around you, you can't,
Yeah, it's
you're
like,
like
yeah,
intimate, 20-30 people or even smaller. It's
yeah.
really nice and intimate. So I'm so
Those are little
excited that
pearls.
this year you're going to lead one. So that's
Thank
exciting.
you. All right. You guys are
So
amazing. Thank you
much.
so much for including me, and all
Oh,
of you.
thank you
Have
for
fun. Have a
the
great day.
time. All
Go to
right.
Miami. Get to
Oh, and
the
go Dodgers.
go Dodgers. That's right. That's right. Where's my hat?
My
My hat.
boyfriend would kill me right now
Oh
because he's
my
a Mets
God.
fan.
See,
But they're out,
I have
they're
two
out. So
hats.
it's
I have
not.
a Yankee cap and I have a Dodgers cap, and I got to wear the Dodgers cap, of course.
Ah,
But it should be a great series.
amazing.
All
Amazing.
right.
See you soon. Thank you so much.
You're welcome. Take
Bye.
care. Have a blessed day. Bye bye.